Hello and welcome to Kami Ideas. If you are new to the channel, don't forget to subscribe, turn on the post notification bell so you receive notifications whenever I upload a new video. Don't also forget to leave your comments and your suggestions. In today's video, I'm going to be reading out the nurse's pledge to you. And if you are a student nurse, you are a nurse, you agree with me that during your matriculation day or on your matriculation day, you recited the nurse's pledge, and then you were taught, it was explained to you in school, in class. And some of us during our school days, we used to recite it almost every morning before we moved to class. And it wasn't just anything it's just any words you say because you have to know it as a professional nurse or something. It's actually an oath that depicts the fundamental principles of the profession. It tells you what you are supposed to do. It tells you how you are supposed to live. Like the nurse's pledge comprises of almost every aspect of our profession. So you are supposed to work or carry or discharge your professional duties according to this pledge. So if you are forgetting anything at all and you remember the nurse's pledge, it should remind you that no, maybe I'm not doing this thing right, so you get it right and get it done well. Why am I saying this thing? Because these days you hear so many things about nurses, especially in Ghana. Nurses are like this, nurses are like that, and sometimes it's so painful to swallow some of the pills that you can actually hear most of these allegations against nurses and all that. And I'm not here to judge the nurse or to judge the patient for this, whatever is happening. But then as a professional nurse, you are supposed to guide yourself. Do what you are being trained to do. Don't let somebody lose a life as a result of your negligence. Do what you are being committed to do. Take care of the people who have been entrusted to you. So today, let's just read the nurse's pledge and we'll see what it states. I'll be reading it out so we analyze it together. That the special training I have received has prepared me as a responsible member of the community. It has prepared you. The special training, that means that's why you're a professional nurse and your training was special. So the special training you have received has prepared you as a responsible member of the community. So you have become responsible in your community. You have become responsible. People's lives have been entrusted to you in your community, where you live, your area, where you are staying. So if you are a professional nurse, you are there, and there's any case, there's an emergency, you have to use your profession. You are responsible to ensure that maybe, for example, an accident has just occurred and you are around as a professional nurse. You can't just fold your arms and join the standby or the onlookers to just watch and say, oh, I'm not in the facility, so it's not my business. No, you are responsible to ensure that maybe you would give your first aid treatment and send this person to the hospital. You are not just a nurse while you are at post. You are a nurse everywhere you go. I must put it down. I promise to care for the sick with all the skills I possess, no matter what their race, creed, color, politics, or social status, sparing no effort to conserve life, alleviate pain, and promote health. You are supposed to care for the sick, care for everybody who is sick, no matter what the person's race. Whether I am this race, I am a Jamaican, I am a this, I am an African, care for every race. Care for everybody. Give the same treatment to everybody, no matter somebody's creed. Let me just say that's somebody's religion. You are a Christian. As for me, I am a Buddhist. I don't deal with Christian. I don't deal with Muslim. I am a Christian. We are enemies to Muslim. I'm a Muslim. I don't do this. It's not supposed to be like that. And political, you belong to party A. I belong to party B. So we are enemies. No. And then, talking about color, you are white, I'm black, white and blacks. I'm giving special treatment to black people, and then the white will say I'm giving special treatment to the white people. It's not allowed. You treat everybody equally. And social status, someone is rich, someone is poor. You are not supposed to side in any way. Don't say because someone is driving a Range Rover and someone comes with on foot or maybe with a bicycle, you tend to attend to the one with Range Rover better. You tend to attend to the rich person better, attend to the person nicely, and the poor person. What is your definition of someone who is poor? And don't forget, some people disguise themselves as nothing for people not to just judge them. So you see someone with a posh car and you treat the person so nice, and because someone is walking and in tattered clothing, the treatment is different. The person comes and like, sit this way, you don't even look in their face, then you are not a nurse. Not at all. Then your responsibility as a nurse is no respecter of religion, social status, political background, race, or creed. Nothing. If you practice your nursing because someone is black, someone is this, red, you give special treatment to some people and don't treat other people the same, you are not practicing your nursing very well. I promise to respect at all times the dignity of the patient in my charge. Respect the person. Protect. If you are supposed to protect this person, protect this person. This person cannot do this. Respect the person. Don't try to expose the person to danger, expose the person to infection. Respect the dignity of every patient in your charge. I promise to hold in confidence all personal information entrusted to me. Okay, this talks about confidentiality. A patient comes to share with you her secrets. Let me not just say secrets. Somebody confides in you with a condition, and then you are supposed to keep that confidential. Don't go to other patients and start talking about it. Or you go to your salon to do your hair and you are discussing someone's condition. You might not know who is related to that patient in one way or the other. So learn to keep the confidentiality of your patients. Keep their information confidential. I have this illness, this sickness. I don't want my sister to know. And the sister comes to the unit and you are being so nice. Be like, let me tell you, do you know that your sister is having this disease and is hiding it from the family? That is no. If you do this, then you are not a nurse. I promise to keep my knowledge and skill at the professional level and give the highest standard of nursing care to my patients. So you keeping your knowledge and skill at the professional level means it calls for revisiting your books. Read more, do more research and keep your skills. How do you keep your skills high? You can't just be holding on to what you learned during your school days. You are supposed to be abreast with the current changes pertaining to your profession. So you don't just be holding on to your old knowledge from school days and something new you cannot manage in the world. Keep your knowledge and your skills at the professional level and give your highest standard of nursing care to your clients or to your patients. So keep your knowledge, be abreast with everything about your profession. No, don't be confronted with a challenge. Don't be confronted with a case and you are fumbling. You don't know whether to turn to the left or to turn to the right because you are lacking some basic information or knowledge about your profession. I promise to carry out intelligently and loyally medical instructions given to me. Yes, you've been instructed by the physician or medical instructions. Do this for this patient. Do this, do that. Carry out the orders. Okay, loyally. Don't do one and leave the other. Don't say, even if you notice that the physician or the doctor has prescribed something that is not in right order, you can go to this person, tell doc, maybe this is supposed to be this, maybe as a result of, we are all human beings, we are bound to make mistakes sometimes or an oversight. So prompt this person, let the corrections be done. Don't say, because from a medical doctor, everything is correct. No, medical doctor is a human being. Anybody can make an error. Okay, so carry out whatever you're supposed to do for this patient and do your work just like that. And you are in the ward. Be a nurse wherever you find yourself. Let your profession be seen in your lifestyle. As simple as that. I promise to share in the responsibility of other professions and citizens from promoting health locally nationally and international. Join in health education communities, organizing debates, those things. You are supposed to participate, share your knowledge, give health education over a particular thing, partake in environmental hygiene and all that. So you help other professions. Don't say it's for land for Ministry of Land and whatever. So you are a nurse, make I stay for my hospital, let me stay in my facility. You are also part of it. So contribute your quota to developing the society, to promote health locally, nationally, and international. So this is the nurse's pledge for you. So if you are a nurse and you are not living according to what you promise yourself, then don't forget that you have a goal to answer to. And one day, let us, when you die, when we all leave this world, let not your profession cause you to find yourself at a place you don't want to be. Of course, nobody wants to be in hell. This is what I'll be sharing with you today. Looking forward to seeing you in the next. Bye for now. Range Rover.